Hey everybody, and welcome back to the Lokalfeed show. My name is Azura, and our guest today is Caitlin from UequalsU. Together with Akila, on this episode, we talked about what is UequalsU and what does this movement or cause stand for. Is there a need to have an open conversation about HIV to create more awareness? Why we need to encourage a culture of testing without discrimination? Does discrimination exist, and how we can be better allies, and so much more. Before we get to it, if you want to support us, there are a few ways you can do so. Share an episode with your friends, subscribe to our YouTube or on any podcast platforms like Spotify, iTunes, Google Podcasts. If this is not your first episode, we truly appreciate you taking the time to listen to these amazing stories and the journeys that they are in. So, without further ado, remember, be bold and stay inspired. Here is Caitlin.
Hey, Caitlin. Thank you so much for sitting down with us today. We're really excited to kind of know more about you and what you do, especially when it comes to UequalsU. So I guess I'll let you take the mic and maybe you can tell us a little bit more about yourself first.
Okay, so I'm Caitlin. I'm 23 this year. So I'm finishing up my degree in NUS. I guess what's related to UequalsU and me is that I went to Japan for a semester exchange in 2018. And then I met my current partner in Japan. We were friends. We were actually like classmates. And then we got closer together. And along the way, I discovered that he was HIV positive. And I've been in a relationship with him for almost 2 years already. And last year, after I came back to Singapore, went on a long distance relationship. So I decided to start UequalsU because I wanted to educate other people about undetected equals untransmittable. Because when I came back to Singapore and I tried researching it, I realized I couldn't find many local sources on it, especially not from the government or anything. So I wanted to start something organic and help educate, like peer educating, peer education, like helping each other learn.
Yeah.
So yeah.
Okay.
Cool.
Okay. I just got a question. To kind of like, because as you're introducing, right? You mentioned something about there's nothing much in like locally that you can find like this kind of like resources. So why do you think that is? I mean, is it because
Well, I wrote into MOH before I started UequalsU. I wanted to ask them, how come you don't have it on your website? Because they have like a tab on HIV and AIDS. And the reply was that this is something that's discussed between patient and doctor. So they say the research exists, but I mean the research for UequalsU has been around for decades. They've been testing it over decades, and they found out in 2016 that yes, the risk is absolutely zero if someone has undetectable viral load. So I think with MOH, I don't know, maybe UequalsU is just very different because the messaging we received when we were growing up, in the 2000s, was that you have to use a condom or you're going to get HIV. Yeah. This was before PrEP, and UequalsU came out. So I think they're just like hesitant to reverse the messaging. Will it confuse people or something? Yeah, so they're quite slow on it. And even a lot of general practitioners like GPs here, they don't know about UequalsU. So when I went to like seek advice, they couldn't give me proper advice. So in the end, I had to speak to my partner's HIV specialist in Germany. But funnily, if you look outside of Singapore, like if you just look for UequalsU, the CDC in America has it.
Yeah, right.
Government websites outside of Singapore have it. Even Thailand endorses UequalsU. So I think here we're just a bit too conservative, even though we need it more because of how badly people living with HIV are stigmatized in Singapore. Yeah.
Okay. Yeah, that's a very good point. I guess I mean the question is because again, right? I mean Singaporeans. I mean there's a lot of like topics and conversation that we actually don't talk about because yes, we are a bit more conservative. I don't know why. I don't know whether it's an Asian
Yeah,
thing or Singaporean thing, but yeah, we're a bit more. We don't
yeah,
talk about
legacy of
sex.
colonialism.
Yeah, correct, right? Yeah,
Yeah.
that's right. Yeah, it's hard for us to talk about sex. It's hard for us to kind of like mention these kind of things which are like either a stigma or taboo, right?
Yeah, yeah. So I think I've been talking about HIV for more than a year already. So for me, I don't find it taboo or stigma. But when people first hear about it, they'll be like, wow.
Yeah.
Yeah. I mean, I'm quite open that me and my partner, we don't use condoms because there's more effective birth control. And he's undetectable. So people who are undetectable viral load can't transmit HIV to you during sex.
Okay.
Mothers living with HIV can have children with less than 1% risk of transmitting the virus.
Okay.
Yeah, so many things are possible nowadays with today's medication as long as you have access to it. So in Singapore, we're a small country and we have a pretty good medical healthcare system. I mean, we have the medication. It's more affordable now than it was in the past, but not enough people are getting tested because they're scared. Your life changes.
So I guess you mentioned about why you started U equals U
Yeah.
briefly. So I guess you met your partner and then you found out that he had HIV positive. So maybe you can kind of elaborate that. Like why was it like U equals U? Like is there any kind of like other support group out there, or what's the current scene like right now here in
Um,
Singapore?
From what I know, there are support groups for people
Okay.
living with HIV. So the way that I go about with UequalsU is more to educate people like who have not been diagnosed with HIV. So educating the rest of us, we don't have HIV. Many of us are heterosexual or we're allies to the LGBTIQ community, but we don't know about UequalsU and maybe we stigmatize people with HIV. So where I come from is to educate people so that they become allies to the PL HIV community.
Yeah.
Yeah,
So
and
that's
I
the
pick
bit
U
where you.
equals U because it is undetectable, equals untransmittable, and it's local. Because I'm Singaporean, so it's local, so it's Singapore. Yeah.
Yeah. Okay, cool. I did sort of. I mean, it's definitely a good start to educate people because it's most people don't know that U
Yeah.
equals U exists. I mean, I admit I had to also Google it and then and do a little bit of reading on it, right? And then it turns out that there are at least in that first page of the Google search, it's pretty international. It's quite a huge conversation topic
Yeah.
in various countries.
A lot of people when you hear about these kind of progressive things, they think it's a Western thing. It's totally not because actually
Yeah.
over 100 countries have endorsed U equals U. I
Oh,
see
cool.
ads. I see campaign materials, from I think Nepal, from Jamaica, from Thailand, all over um, in the African continent as well. So it's definitely not isolated to one part of the world. Yeah, I mean, to become undetectable, it really depends on the resources you have and a society that also stigmatizes PLHIV more can lead to lower adherence rates. So we need to change our society to become more accepting and to reduce HIV stigma if we want more people to get tested and
Yeah.
stay on their treatment, right?
Yeah.
Yeah. So the whole movement, I mean, it started. I mean, by 2008, they knew that, or they were like catching on. 2008 or 2011, they were catching on that there was no risk of transmission, HIV transmission during sex for heterosexual couples,
Okay.
but they weren't sure whether it was the same for male gay couples, who had anal sex. So really, in 2016, when the results from Partner 1 and 2 studies came out, that, oh, yes, it is effectively zero risk for both heterosexual and gay couples.
Okay.
Yeah, so the movement has been building. More and more people are endorsing it, more countries are endorsing it, and some of them even have public health campaigns. You know, like my partner last year, he was an ambassador for a nationwide campaign in Germany. Shared his story, and it's a video on my Instagram. So, countries are trying to educate more and more people about UequalsU so they can build a more inclusive environment. There's nothing to fear nowadays about HIV.
Mm.
Yeah. And I wish Singapore would, start this as well.
But
But
the
it
thing
will
is,
take a while.
okay, so I know just now you
Yeah.
mentioned PLHIV, right?
Yeah.
I mean, we both know what, I mean, all of us know what PLHIV is. Maybe if you could, like, what is that term?
People living with HIV. So
Yeah.
it's more preferable to say that than HIV positive. Well, it depends, like as an ally.
Mhm.
Um, it's better than say HIV patients, because
Mm.
patients rather means sickly, right? That's not the case. Unless they're in a hospital and a doctor calls them patient, then it's
Mm.
different. So PL-HIV is the best to use
Mm.
because it's a chronic condition. You live with it.
Yeah.
But your HIV doesn't mean that's who you are. It's not your only identity.
Mhm.
So
Okay.
yeah.
Yeah.
And then I realized that there's different terms that people actually use for like HIV or AIDS. It's not really AIDS anymore, right? It's like you call it like HIV positive or
Yeah.
and stuff. So if you could share with us a bit
So
about the
like
different
with
technology.
HIV, there are stages.
Mm.
There's the
Okay.
acute stage when you first get it.
Mm-hmm.
And it enters a latency period because you're not on medication. So HIV only progresses to AIDS when you're not on treatment for quite a few years, right? And
Mm.
your immune system deteriorates. So the CD4 count is basically a normal person. I'm trying to remember my boyfriend's CD4 count. Well, it's just below 1,000.
Okay.
But when you have AIDS, it goes below 200. And
Ah.
your body is much harder to fight off infections. You may need to get hospitalized. So, and that's really the end stage. However, if you get treatment while you're at the final stage, which is AIDS, you could
Mm.
still turn around.
Okay.
You could still get better and become undetectable, because that's what they realized when they were testing all the medications. Even
Mhm.
those in the later stages could make a recovery. But again, it depends, because as you progress further and you get AIDS, you can have more serious conditions coming up.
Mm.
But
Mm.
even if you're AIDS, get treatment. If you have AIDS, sorry, get treatment.
Right.
Yeah. Yeah. So the idea is that we want to stop HIV transmission and the progression to AIDS. So
Yeah.
stopping HIV transmission would mean getting treatment as soon as possible, getting diagnosed and getting treatment,
Mm.
and staying on treatment. Yeah.
Okay.
But just to be clear, not everyone can have an undetectable viral load. The majority can, but not everyone can. So it depends whether they adhere to their medication, or they
Mm.
do, if they have a drug-resistant HIV, and they would need more medication perhaps.
Yeah.
And then there are some people, rare, but there are some people who just cannot become undetectable
Okay.
Mm.
through no
Okay.
fault. Like
Mm.
they may adhere to their medication, but they just may not be able to become undetectable, but they can still be healthy.
Okay.
Okay.
Yeah. So it's just well, with HIV is really a very like medical science topic. And very often the science kind of gets lost, is not made more understandable.
Mm.
Yeah.
Yeah,
Yeah.
So even when I'm researching, I have to like look for different sources to explain the same thing. Just one thing is easier to understand than the other.
that's
But I
true.
guess, but I guess that's the good thing, isn't it? Like, I mean, education, right? I
Yeah.
mean, like that's a huge factor, because now that you've mentioned it, how does one actually even find out the very first time that, and then from the acute HIV stage and then the latency period, because they will need to go through that stage first before we,
But actually, I can
be on treatment, right?
yeah
So
answer. So like I always had these questions, and then I bought a book. So I got 100 questions and answers about HIV and
oh,
AIDS.
cool. Okay.
Okay.
So literally keep reading.
Yeah.
So this book, it was written by a doctor, and he says it's suitable for healthcare providers and people who've just been diagnosed.
Mm.
Yeah,
Okay.
and it's pretty understandable. And for
Okay.
like words they use, they have like small boxes at the side
Mm.
that help explain those words.
Mm.
So I think, even if you don't have HIV, or even if you don't know anyone who has HIV, educate yourself.
Yeah.
Because at some point you probably will meet someone who's living with HIV in your life.
Yeah.
And it's really important to know how to treat them respectfully,
Mm.
treat them as an equal,
Yeah.
and not live in irrational fear that they want to transmit HIV to you. Yeah, that's a quite irrational fear. I don't know in Singapore, but I mean around the world, people living with HIV has been painted as dangerous, as harmful.
Is it still today though? Till
Yeah,
today,
yeah,
they
yeah,
still have.
definitely.
Okay.
Like there's these images of HIV are still around. I've met with elders in my family and some out of my family, and they still call HIV/AIDS. Then they don't
Mm.
know the difference. Well, we don't have many public health campaigns, so I can understand that they don't know the difference. But
Yeah.
also, yeah, some people think that people living with HIV are all promiscuous. They think it's a gay disease, which is very weird
Mm.
because over half of the global population of people living with HIV are women and girls.
Hmm.
Mm.
Yeah. And there's these outdated images that people living with HIV are sickly. You shouldn't hire them because they're going to take so many sick leave or something.
Okay.
Even in Singapore, it's really hard to get insurance if you're living with HIV.
Yeah.
As I know, you can't get insurance. Even if you're undetectable and
Oh,
you're
really?
healthy, you can't get insurance because of these images of HIV, the costs, the costs
Yeah.
of
Yeah.
they're gonna fall sick, they're gonna deteriorate easier.
Yeah.
But with medication, you know that that's not the case. You see, we have to unlearn a lot of these
Yeah.
stigmatizing images and perceptions of people living with HIV.
Yeah.
Yeah.
I guess we would say that, I mean, this whole stigmatization, it's really from the past, like how you said, like, you mentioned 2008, there was a research, and then came out that, if it's undetectable, it's not,
Yeah.
it's untransmissible, right? And then
Right.
in 2016 as well, with the same-sex couples, right? But why do you think, I guess it boils down to people not knowing, and still a little bit ignorant, do you feel? Like that's just the
I
stigma? Like,
don't,
why does it still exist though?
why does it still exist? I don't know. When you tell people something, the first thing they want to do is rebut you, don't want to listen because they don't want to admit they were wrong, or that um,
Mm-mm-mm.
they didn't know something, and it's okay if you don't know it, but now that you do, it is time to change, right? But some
Yeah.
people are just a bit stubborn, and I've heard like weird reactions such as, okay, but I still wouldn't like date someone who has HIV or like sleep with them, and then I'm like, I'm not asking you to do that. Yeah.
Okay, yeah, that's a very
Yeah,
weird
people
reaction.
make illogical leaps
Yeah.
before
Yeah.
they actually internalize. Yeah.
Yeah.
I mean, if you know about U equals U and you refuse to have sex with someone who has HIV, it is stigma, and that's not ignorance anymore. There are so many resources. Feel free to refer to my page if it helps. But more importantly, now you know the information, you have to practice it. You have to practice telling people about it. So whenever you hear like um, HIV stigmatizing comments about HIV, speak up.
Mm.
So people know that's not right. I mean, this is science.
Mm.
Yeah.
Please don't get science wrong,
Yeah.
at least. Yeah. I mean, there's no debate about this. Like, you may think there's a debate, but this is what the science is telling us. So,
Yeah.
really practice telling people about U, about people living with HIV. Draw attention to the struggles that people living with HIV face. I mean, nowadays in Singapore, there are stories of failed HIV. They can be anonymous or they cannot be. So I would encourage you to read their stories.
Mm.
We will never know what they go through, but we can just at least see and tell people, the emotional pain that's involved in this, right? And have like encouraging people to have empathy. So as an ally, you need to have empathy.
Mm.
And just to be clear, as an ally, there's no sympathetic or unsympathetic person.
Yeah.
Yeah. So I know I've heard comments about while I was educating people like face to face. Yeah,
Mm-hmm.
and then I'll hear comments like, um, I feel sorry for kids born with HIV.
Oh, okay.
I feel
Oh.
sorry for women who were infected by their husbands because the husbands maybe had an affair or were using drugs, their needles, right? So they are sympathetic victims at times.
Mm-hmm.
But I would say no one deserves to get HIV. And so we have to remove the moral judgment we place on people who are diagnosed with HIV. Yeah,
Yeah.
so as an ally, we have to reserve our judgments and
Yeah.
focus on being helpful and not harmful.
Yeah.
Yeah. So like when someone tells you they have HIV, don't say like, where did you get it from? How did you get it? It's none of your
Yeah.
business. Like if they want to tell you, let
They
them
will
tell
have
you.
to.
Yeah.
Yeah.
Correct. Yeah.
Yeah. Yeah. So like sometimes people also ask me how Marcel got HIV. Then I just look at them, sex.
Yeah.
And
Yeah.
yeah, I mean he's very open about it. But I
Yeah.
find it quite ludicrous to even ask me
Yeah.
how he got HIV. It does
Yeah.
not matter.
Yeah.
Yeah. And if someone tells you how they got HIV, don't judge them. Leave them be. You know,
Yeah.
empathize with them, talk to them. You know,
Yeah.
be a friend, especially if you're a friend or a relative. Okay. Don't pressure people living with HIV to come out to their families or to their friends. You know,
Yeah.
it takes a while. Like for Marcel, he only told his parents after 2 years of living with it, after being diagnosed. It takes people time to tell those around them, especially in a society that has quite a lot of stigma, right? So,
Mm.
as an ally, don't rush someone to disclose their HIV status.
Yeah.
Yeah. So, I mean, there are many things we could do. A lot of this is, you have to practice
Yeah.
and stuff. Even for me, I have to learn from mistakes. So, for example, when I first started UequalsU, I was really eager to have stories to share on
Yeah.
my platform. So, but then I realized that I shouldn't pester people because it's harmful, right? It's not easy telling a story, even if it's anonymous, because telling your story brings up a lot of feelings. Being diagnosed, being on treatment, all these things, it brings out a lot of feelings. So, even though I want to help and give people living with HIV a platform, I also must know not to push too hard. Ask
Yeah.
once, if they say no, then leave them be.
Okay.
And yeah, so it's a learning process. You will make mistakes. Like I've made
Mm.
mistakes, and we just have to keep going even when we make mistakes.
That's
Yeah.
true.
Yeah. Because that's the I think the part where you don't judge is very important because
Yeah.
I feel like whenever you tell something, I mean things like this, you know, it's people just judge, and then that's when the sympathy comes in, and like
That's not very
they
helpful.
as yeah, exactly. So I guess there's always like a predisposed assumption of how something is like, especially when it comes to HIV, but not just HIV, but a lot of other issues in Singapore.
Yeah.
So I feel like this is a very important conversation to
Yeah.
have, especially when it comes to don't judge and be empathetic and be a friend. I think that's like the most
Yeah. Just
important
talk
bit. You
about it.
wouldn't treat your friend like,
Correct.
and make them,
And
especially when they I guess it's bad enough, like you mentioned a few things that people living with HIV here, especially in Singapore, go through, like, the discrimination they go through.
yeah.
We touched that briefly, but from your experience, really in the past year or two, what other kind of discrimination do they go through?
Well, this part I have to write down so that I don't miss anything.
You got a
There's a
lot.
long list.
There's a list. Yeah.
There's a
Really?
list.
Okay, okay.
So
Wow.
I know about insurance. You can be
Yeah, you mentioned insurance. That's really sad. Why?
so many things not related to HIV, and you're not insured against. And it's quite unfair, right?
Yeah.
But I hear it's changing.
Okay.
Like some companies are thinking about it. But again, I have not seen something comprehensive or well publicized.
Mm,
Yeah, so we still need to keep going.
yeah.
Wow.
So another one I wanted to talk about is the fact that you need to disclose your HIV status to a partner before having sex. So when I because myself is from Germany, right? So we talk about our laws. And in
Mm.
Germany, if you take precautions like wearing a condom or having an undetectable viral load, you actually don't need to disclose to the other person that you have HIV.
Okay.
Yeah, you don't need to do that at all because you're not going to transmit the virus.
Mm.
And
Mm.
if, let's say, I mean, you're using a condom, you've already drastically reduced the chances of transmitting.
Mm-hmm.
And also, if you have an undetectable viral load, zero chance of transmitting.
Okay.
So, at first when we hear this, we're like, wait, why? Is this safe or anything? It
Mm.
is, right?
Mm.
But in Singapore, you have to get consent from the other partner. And the problem with that is that imagine it's just a hookup. I mean, let's be realistic. Not everyone is in like long-term monogamous relationships. Okay,
Yeah,
Yeah.
that's true. Okay.
so what if it's a hookup and you have to tell the person you have HIV and the person publicizes you have HIV on the
Mm.
dating app,
Oh man.
which has been done, as I've heard from a
Yeah.
spokesperson from Action for AIDS. Why
Wow.
should you be forced to disclose? It's very intrusive.
Mm.
And it basically tells people like we don't trust you.
Okay.
So and then I was just thinking about there's a few other arguments. Like I have to know, but why? If there's no risk of transmission, why do you have to know?
Mm-hmm.
Because we stigmatize HIV so badly to the point that every time we hear about it, we get scared and then we don't
Mm.
want to have sex with the other person. So can you imagine how the person living with HIV feels? Like how many times they get rejected
Mm.
because
Yeah.
of our ignorance and stigma. So
Yeah.
stop forcing people to disclose when they're not ready or they don't want to. It's
So
more
okay,
important. Yeah.
just to be clear, this is a rule in Singapore
Yeah,
that
yeah,
you
it's a
have
law.
to
It's a law
disclose.
you have to disclose. Otherwise you face jail time and a fine.
There's
Wow,
actually a
really?
penal code, like
Yeah,
a proper penal
yeah,
code
yeah.
for this.
Okay.
In the past maybe it made sense because there wasn't medication.
Mm.
Mm.
But again, like in Germany, the way that you would prosecute someone is that if someone intentionally
Mm.
spread HIV to you, meaning they know they have HIV, is not treated or is not undetectable, and they choose to have condomless sex,
Mm.
then it's wrong. That's malicious, right?
Yes.
And not everyone is like that.
Yeah.
Again, we think that okay, what if and what if that, and then I say like if you're worried, then ask the other person to use a condom. You should use anyway, okay,
Mm.
for prevention of other STIs like herpes, gonorrhea, chlamydia. But again, don't reject someone who has HIV. Again, this law is just strange because it really forces people living with HIV to come out
Mm.
whenever they want to have sex, whenever they want to start a relationship,
Mm.
come out too soon.
I find it
Yeah.
very funny in the sense that they have to disclose, but they don't provide enough information,
Yeah,
for people who are not aware of what HIV. Then it's just
Mm.
directly trying to put them one corner and just kind of like,
correct,
you know,
correct.
right?
Yeah, I
Yeah.
mean, if you want them to tell people they have HIV, you need a society that's very well educated on
Yes, that's
HIV,
right.
Yeah. That's
equals
true.
you.
Yeah,
Otherwise, you're gonna have like a lot of stigma, a lot of discrimination.
right.
Yeah.
I just won't take the risk or something. And my reply is that if you're really worried, you can take PrEP. You can use condoms. Okay. Me and my partner don't use condoms or PrEP because we have trust, right? I know he takes his medication. He goes regularly to monitor his viral load. That it stays undetectable. So we have trust. We have communication. So again, it's if you're in a long-term relationship, then it takes a while to decide whether or not to forego any condoms or like using PrEP,
Mm.
right? So again,
Yeah.
it requires a lot of trust and communication. You have to trust that your partner living with HIV will not stop taking that medication for whatever reason,
Yeah.
and they will keep going to the doctor to monitor their viral. But again, this for hookups, it's not. It doesn't mean it'll be a long-term relationship, and people have sexual needs. So yeah, this law is really in their disadvantage
Mm.
unless they can find someone who's understanding. But as we see from Singapore, LGBTIQ community,
Yeah.
a lot of stigma.
Yeah.
Yeah. Oh, and then another law,
Okay.
Okay.
a
Go
new
ahead.
so foreigners living with HIV are banned from living and working in Singapore.
Whoa.
Yeah, there's a law. So how would they tell? Do you have to come to Singapore and do a blood test
Yeah.
in Singapore? And even though you have an undetectable viral load, once you contract HIV, there's a certain like antibody protein or something in your
Mm.
system. So I went for HIV checkup, and they said I don't have this protein. Okay, so but if you are living with HIV, they can get this from you, even if you're undetectable. Doesn't mean you're infectious or anything. Just a protein in your body. So
Mhm.
the test would pick it up, and then they will know that you're living with HIV. So foreigners are living with HIV, cannot work in Singapore, cannot stay long term. If they are married to a Singaporean, then they can stay more than 90 days. I don't know what that means because the website doesn't tell us anything about medication,
Okay.
about can they find a job? Are they allowed to? What kind of path would they be on? Could it ever progress to become permanent residency?
Mm.
Okay.
All these things unclear, ambiguous.
Hang on. So this is a legit law.
Yes, the
That's
law is the law.
wow.
Yeah, yeah.
Okay.
So I guess
That is
before they come in, they have to take a medical checkup, lah, right? And then they
So
can see the antibody.
they come in and they do the blood test in Singapore.
why can't they just so they don't wait. Wow, okay. So they technically have to fly to Singapore to do the test. And then if the test says they can't work and stay in Singapore.
They're deported.
What?
Yeah. So if you're already living, so let's say you passed the test, you didn't have HIV when you first came to Singapore, and you're working, and then one day you're diagnosed with HIV,
Mm-hmm.
you
Mm.
get deported within like 2 weeks. They're quite fast with this.
Wow. That
Oh my
And
itself
gosh.
that itself is quite
and
mm,
just to let you know, in 2015, Singapore finally removed the ban on tourists coming to Singapore with HIV.
In 2015.
That's not
That's
that
like
far. It's not that far. That's not long ago, It's quite
yeah.
recent. I mean,
okay. Oh
before
wow.
that, how would you know
Yeah.
Yeah,
in
yeah, exactly. No.
the first place? So it was just more of a statement, that we don't want you. And I find
Wow.
it really strange that you penalize uh,
Wow. Okay.
people living with HIV who have been diagnosed. And quite a few of them are on treatment, and you're penalizing them.
Yeah.
It could really be easily managed. You could easily, like, foreigners living with HIV, foreign nationals, if they were living in Singapore, just make sure and make it compulsory for them to go for viral load monitoring,
Yeah.
like every 3 months, every 6 months, and then they stay undetectable,
Wow. I'm
right?
mind blown. I didn't know that.
Oh, I didn't know that either.
I think you can research on this. Yeah. Yeah,
Okay.
so that's why Marcel can't come to Singapore, even though he wanted to, he can't.
Wow.
Wow. He guess as a tourist he can lah, but he can't be doing anything else. Like can't be
Yeah, he
working and all.
can't work here. So our plans is that I would eventually go overseas. My
Mm,
plan is probably
Yeah.
next year, depending on how COVID goes.
yeah.
Yeah.
I will probably do my masters and then work overseas for a while. Because even if we get married, I don't know what would happen to him when he comes to Singapore.
Mm.
His medication could change. It could be more expensive, less expensive. I don't know. There are too many ambiguities about it
Yeah.
that you can't plan for the future.
Wow. Okay.
Yeah.
And not only that, I guess things changes like,
Well,
just
that's
like
my
that.
hope. It changes.
Yeah.
Yeah.
Okay.
And I heard from a friend that she knows a lady. She's living in Singapore. She has HIV. She's married to a Singaporean spouse. But she can work, but she has to tell the company that she has HIV. Just like what?
Okay.
But why do you have to tell the company? Yeah. Okay. So that brings us to our next strange law, which is that when you enroll in school or employment, they ask you whether you have HIV or AIDS.
Yeah.
I don't see how that is relevant because what they could do instead is that do you have a condition that you would like to let us know so that we could help you or provide assistance? If so, tell us what.
Yeah.
That is a way better way to say it. So Nurifika, when she first enrolled in Singapore Poly, she told me that she had a checklist. And then they asked her, do you have this? And then first on top is HIV/AIDS. You have that.
Okay.
And if so, Nurifika helps run our Facebook page for UequalsU. She's a woman living with HIV publicly
Okay.
in Singapore. So yeah, and then when she disclosed that she had HIV, they pulled her aside for a whole separate interview. And she told me how the admissions officer was quite rude, like asking her, can you transmit HIV by sharing food with your classmates?
What? Wait.
What? Are you
Yeah.
serious?
Where is
Oh
the
my gosh.
sensitization training? Just not there.
Oh
Oh
my God.
gosh.
Yeah. It's terrible, right?
Yes,
It
it
shouldn't
is.
be like this. Again, like this whole idea of forcing people to disclose their HIV status, it's very strange because it is none of your business unless I deem it necessary to tell you, right?
Yeah.
Yeah. So yeah, so there are a few. There could be more. This is just the ones I can remember off the top of my head.
Okay.
Yeah.
Yeah.
Again, if you want to find out more information, and also just links to being an ally, you can also volunteer for Action for AIDS or gayhelp.sg. So one is for the gay, bisexual, MSM community in Singapore. Oh, sorry, the questioning community in Singapore, so for men. And then the other one is for just in general. So you can be female and volunteer for Action for AIDS. You can be heterosexual and volunteer for Action for AIDS. So they have a few branches. There's outreach. There's also mobile testing, HIV testing. There's the anonymous clinic they have. There's also education. There is I'm missing one. There. Okay, I'm missing it right now, but there's a lot of avenues you could pursue if you volunteer.
Yeah.
I mean, this is if you have time and you have the energy. But it's also a great place to learn stuff. Like you could ask not the staff, like what about your work? What's going
Yeah.
on? What are the issues? Yeah, so I'm just one source, and there's a whole organization. But to be fair, also it's really hard for them to talk about UequalsU because they have so many other programs that they need to run.
Yeah.
So my part is to help educate people specifically on UequalsU and the basics on HIV and all that. And something I forgot to mention, if someone like maliciously transmits HIV to you, you can actually do genetic testing, and genetic testing will tell you whether it's a linked transmission.
Okay.
HIV virus isn't the exact same copy for every person. It changes and mutates along the way.
Okay.
Yeah. So there's just something I forgot to mention, but I thought I should cover it. There are ways to tell if someone maliciously transmits HIV to you.
How important is it for them to go for their testing? Because
Extremely important. Yeah. It's extremely important to get tested at least once in your life. So I was reading the CDC guidelines, and they said any adult above 16, above 18 should get tested for HIV, regardless of your gender and sexual orientation, unless you've been abstinent your entire life or something, then you need to get tested.
Okay.
And if you're traveling and you receive hospital treatment abroad, maybe a blood donation, get tested. Because not every country may properly screen for HIV. Like it depends where you go. Like you go to a place that doesn't have much of a healthcare system. And again, if you use drugs, use needles, get tested. Not just about sex. It's also about there are many ways to transmit the virus. It's bodily fluids, not saliva, not sweat, but blood, vaginal secretions, anal secretions, all these things. And I guess that's the thing, as allies, we have to create a more inclusive society, less stigmatizing, that encourages people to go for testing. We need to tell people about UequalsU so that they know once I get HIV, life won't stop. No,
Yeah.
you can go on living a healthy life. You can have kids if you want. You can have safe sex and not transmit HIV to your like partner or loved one, right? And at the same time, I feel we talked about the laws, and I feel quite strongly that we have to change the laws if we want to encourage people to go for testing.
Yeah.
So, like, when you get tested, prepare for a worst case scenario, which can be many things. You have to be in the HIV registry that had a data leak.
Oh yeah, the one
Wow.
that's recent.
Wow. People were panicking. People living with HIV, they were scared their bosses would find out. All these things. The family would find out, they get fired. It's terrible. So you have to go on a registry. For the rest of your life, you have to tell another sexual partner if you have HIV. What will happen? What will your parents say? Will you have friends? Oh, all these considerations. But for the sake of your health, please get tested.
Yeah.
I wish we could change the laws, but we can't. You can go for anonymous testing. You can go for non-anonymous testing. So anonymous testing is, Dr. Tan and partners. They have clinics, but there's also Action for AIDS. They do anonymous testing. There's also non-anonymous testing. So it's not anonymous at the DSC clinic. It's cheaper. Getting a HIV test doesn't have to be expensive. There are affordable ways to get it. But please get tested.
Yeah.
What's the price range? Because you said that it doesn't have to be expensive, right? I mean, the ballpark, you don't have to give the exact amount.
So if you go to a private one, so I went to a private one and the results took maybe a week or something. How much was it? More than $50.
Okay.
But that's for like a GP.
Okay.
I know Action for AIDS is 30-ish for anonymous testing.
Okay.
And then for the DSC clinic, it's even lower than that. But it's not anonymous.
Okay.
Yeah.
So so my suggestion would just be to go to Action for AIDS for the anonymous testing. But if you're okay with it not being anonymous, then the DSC clinic.
Okay.
It's quite affordable to get tested lah. And also like Action for AIDS, they do like mobile vans, and if I'm not wrong, it's free testing. So yeah, so the way it works is that you have a reactive test, and then they have to test it again for the Western blot. So the Western blot, 99% confirms that you, more than 99% that you have HIV.
Okay.
The reactive test is an indicator you could have, but you need to finish it up with the Western blot. So it is possible to get tested. It is affordable, but I think it's just there are mental obstacles. Getting tested. And as I said, a lot of things will have to change to get everybody tested.
Yeah.
And
Wow.
yes, we have to change our sexual healthcare education, please. Please.
Start from school, man. That's like,
please.
it's gonna be
immediately.
Actually, that's true. Actually, that really is true. But again, I guess, I feel that is the conservative part a bit about us Singaporeans, that we just want to kind of like keep it safe and don't talk about things that are not supposed to be talked about. Just just leave it be. If it doesn't happen to you, just
let's not be fooled. Every year there are 300 or so cases that come up.
Okay, I was about to ask you, as in, is it, because we don't hear it in the news, we don't hear it, right, Akila? I mean,
we hear in the news? Like people living with HIV didn't know they had HIV and donated blood. That's what we hear in the news, okay? What kind of image does that paint?
Yeah, right? It's fear, we just fear, so it's yeah. So
Well, sometimes they say it, but again, these 300 cases, not everyone who has HIV is being tested. 50% of people who are diagnosed, right, voluntary, not voluntary, but 50% of them are in the later stages of their HIV infection.
Wow. Okay.
Yeah. So, and by then maybe they find out because they were in the hospital. or something else, and then the blood results came.
Okay.
So honestly, we need to encourage a culture of testing. That having an STI, having HIV is not dirty, it's not wrong.
Yeah.
Yeah.
It's more important to get tested and treated. We have to change the conversations we have about sex and STIs.
Yeah.
Yeah, firstly, don't call it STDs because these like diseases is like it's not infections. Try that instead. The language you use matters, and we need LGBTIQ inclusive sex ed. We need to teach about PEP, U equals U. A lot of things we have to teach and prepare young people. And we have to, honestly, I've written this in the post, we have to repeal 377. Because 377A just encourages homo negativity, encourages internalized stigma, and that makes you like more at risk of engaging in like maybe unsafe sex practices.
Yeah.
So a lot of things, it has to change if we want to end HIV transmission in Singapore. It is possible, logically, it is possible to end HIV transmission.
Yeah.
We've just got to be open about it and talk about it.
Right. And because, we live in a society where the government has to take a lead for a lot of stuff. Government has to step up. And, they are unwilling, but as time passes, we may see a change in the values of leaders. I'm hopeful for it.
Okay. We have to be hopeful, right?
Yeah. Otherwise, what's the point of even trying?
That's true.
I don't think we could do better. And we can. It is possible.
Yeah.
And on occasion, I'll get weird comments from people like, why do you do this? Or like, why do you talk about your sex life in these interviews? I say because it's important now.
Unless they're telling you they don't have sex, then but
I have friends who have never had sex yet. Same age. Okay. I mean, it's up to you when you're ready to have sex.
Yeah, of course.
Yeah.
So I will just share because I have the privilege to share. Because my partner's living in Germany. There are a lot of protections for him. That when he comes out publicly, there are protections in place to safeguard him.
Wow, okay.
Unlike in Singapore, with the whole job insecurity and stuff. So I am in a privilege because he's not from Singapore. It's really different here than it is in Germany. And he's very open about his HIV status, how he got it, and what he does with his life. And because of that, I've been able to talk about UequalsU, like being in a relationship with him. And he's queer. It's not straight but we are straight passing because we seem to be we are heterosexual, like heterosexual relationship, even though he's not heterosexual. So I find that in Singapore, people are more willing to listen when it comes from a heterosexual couple. When it comes from a gay couple, they're very judgmental and conservative. So I have to be able to use my privilege to help in some way, right?
So in Germany, that means if someone were to fire him because he has HIV, he can sue them, kinda?
Yeah, definitely.
In Singapore, you can't do that because
when people fire you,
it depends on the company. Yeah.
Whether it is your HIV.
Okay.
Yeah. Okay. When they hire you and you have to disclose your HIV, if they reject you, do you know whether it was your HIV? It's a question mark. It's not clear.
Yeah, true.
Yeah.
Because there's no robust law. I mean, there's laws that tell you can't disclose someone's HIV status. That's not enough. There needs to be more. Because it is so highly stigmatized. It is true that people living with HIV, they're a person, that they can live just like us. But let's be mindful that living in an environment that stigmatizes them, they face more challenges than us, So as much as we want to be equal, the reality, it is not there yet.
Yeah.
We have to keep working, and allies need to step in and not overshadow, of course, but keep talking about UequalsU, correct misconceptions about HIV, encourage their friends, be there for their friends when they get tested. All these things. And I mean, that's what I try to get. That's what I try to do with UequalsU.
Okay.
Because the PL HIV community, they have themselves. They have an agency as well. They also have Action for AIDS. So I would always be open to PL HIV who want to share their story on my platform. Definitely can. But I also understand that it's hard for them. So they have to do so much emotional and physical labor themselves. So that's why allies, we're brand new, we're fresh, we can help.
Yeah.
Even if you didn't know once, like now you know, right?
Yes.
So if someone says
definitely.
something about HIV, there's a misconception, a myth, you could speak out.
Yeah.
Yeah, and I think it really, you have to start from there and keep going.
It's important. I mean, it's important what you're doing. It's amazing. I mean, I was thinking, listening to you, I was like, so inspired because to be honest, I'm just inspired because it is hard work. It's tough because especially talking about something that's so taboo, stigma,
Taboo, yeah.
right?
Especially in Singapore, right?
Yeah, I mean, I'm thankful that you want to talk about these issues. Always great when people want to talk about HIV and AIDS, and it is challenging to interview a person living with HIV. There are a few people publicly living with HIV, but again, like ask them, they may not have the emotional
Capacity,
capacity, because whenever they do interviews, like I know from Rafika, whenever she does interviews, it's a lot of emotional labor that comes into telling a story, right? And you don't know whether the other person, like you guys are great, but you never know when you're being interviewed. What's the other person like? What are they gonna ask me?
That's true.
So whenever like people living with HIV tell their stories anonymously or not, I think it should be applauded. Like thank you for speaking up. Yeah, he found out when he sent a Facebook request to Marcel.
Okay.
As I said, Marcel is quite open. He's an activist, so he does have he has a post that he talks about his HIV status and coming out, what it's like for him. And my dad just found out through that way. And then he told me he couldn't sleep one night, and then next day he asked me, and so I said HIV, is it? I had to spend months sending him articles, educating him. But I think end of the day he's receptive lah. He trusts science.
Okay.
He did ask me how Marcel got it, and I told him sex lah. And then I was like, and then I told him quite after that, it doesn't matter. And then my dad is, and he realized, okay, it doesn't matter. So my dad is very accepting. He always asks about Marcel. Sometimes they talk to each other. Like when I'm Skyping him, and then my dad comes in, and then we have a discussion.
They're mini discussions.
Yeah, no mini discussion. I just chill lepak inside. And then and then he's quite accepting. It's taken a while. I mean, I did a HIV test after, so we had condomless sex in July when I went to Berlin. I got tested in December, and it was negative. It's actually on the UequalsU platform now. I went to Dr. Tan and Partners to get the test.
Okay.
And I showed it to him, and he's like, I think that made him a real believer, like an absolute believer in UequalsU. Yeah, and he does educate his colleagues about it. My dad is 50 plus, okay? He is from the conservative generation.
Yeah, that's true.
That's nice.
That's true. Want to do it, all right? So he educated his partners, his colleagues, and then they understood. They asked questions, he answered them. He also sent a few of them articles. So it pays off. It takes a while, but I have the energy to do it.
Yeah.
I had the energy as well. And then my mom, he told my mom after a few months.
Okay.
She got no reaction now. I don't know. This Nonya Eurasian woman was just stoic. Okay. Yeah. Then I asked her, do you have any questions? And she said, no.
Okay,
that's nice.
She's just like that.
Okay.
Yeah.
So they've been pretty supportive. I mean,
I would think so, yeah. With my other family members, they know about it, but they don't really talk about it. It's okay to have questions. You can direct your questions at me. I don't live with HIV, so I have the energy to keep telling people over and over again. And the privilege that I have, I can keep telling and educating people. With friends, quite a few friends are supportive. I've lost a few friends who've made like comments about myself, which I will not tolerate.
Okay.
So, I mean, they're always surprised at first when they hear about UequalsU and the medication and HIV. But they are open. Quite a few of them are open to listening. And the friends that left, they just left. It's just like that. If they didn't want to, they just didn't want to like believe it, or they said something that I called them out on and they couldn't take it. Yeah.
Anyways, yeah. I mean, then you know that they're not your true friends, right? So,
Yeah, like the relationship already got problems.
Yeah.
Yeah. I mean, like when I tell people that he's living with HIV, they're generally quite shocked that how can I reveal such a thing. But I mean, I've cleared it with myself. He's totally fine with it. Yeah, especially if it's in Singapore, he knows the situation is like more difficult, so he's happy to like let me share his story. While I attempt to like help people understand more about HIV and UequalsU. So I'm quite grateful for him. Yeah.
I mean, yeah, because I can understand, because if let's say he's not an activist or he's not openly, sharing, it's a bit hard.
It's harder, yeah. So I'm grateful that he is open about it and he's willing to he's allowing me to share his story. That it's important that I get his consent as well.
Yeah, that's true.
Yeah.
I mean, in your attempt, Caitlin, to educate people about this, right? I'm sure there are naysayers. I'm not sure. Are there like, like what are your struggles? Like, how do you, I mean, even with your Instagram account and stuff, do you get like people messaging you and be like, dude, maybe you can just share with us a little bit about that, like your struggles.
It depends. There's sometimes people like leave terrible comments in the comment section and I just delete them because these comments are not okay. I have no problem deleting offensive, inflammatory questions. And if anyone DMs me, I will answer them honestly. I have seen, not from on my account, but other accounts, they take screenshots of conversations. And I always, whenever I get a message, I prepare myself that I'm going to get a bad comment. And usually it's not the case, but there are some. And it depends, like if they're asking questions, I'm more than happy to share and we have a conversation, Yeah. But if you're just going to leave something that I don't believe in science, and I'm just not going to tolerate that. Yeah. I mean, I have to set boundaries for myself. And have I challenges? This long distance is a bit of a killer sometimes, especially with COVID.
Yeah.
The law banning him. That's I think the biggest challenge on a personal level. Not being able to be with him. Eventually I need to uproot my life because I want a future with him. He knows that I want to like marry him and propose to him. But I will do it long. Yeah.
You go, girl.
I'm not a fan of rings. I'm not a fan of diamonds at all. So it's better that I buy rather he buy and then no. Yeah, so like I think the killer is, especially now with COVID, I haven't seen him in about 7 months. Yeah. Actually, I could go to Denmark. They allow partners, even non-married partners, to come. He's studying in Denmark now. But I can't because if I get sick and I come back to Singapore, I have to pay for everything.
Yeah.
So I'm waiting for Singapore to let him in.
Yeah.
That's the biggest challenge I feel. But again, I'm not living with HIV. So whenever someone gives me a bad comment, I do have some distance from that comment. And I will just answer rationally. Yeah, so it's different for someone who's living with HIV. It can be harder because it's personal. Yeah. So whenever if I get a bad comment, I immediately delete it before Norika sees it.
Oh, okay, yeah.
Like, why should she have to see like these things?
Yeah.
Like, we know they exist. but doesn't mean we have to put the other person through it.
True.
Yeah, it's harmful. So yeah.
Okay.
Yeah, but otherwise, I'm quite happy to keep going. But right now, I'm doing my honors thesis, so I can only post about once or twice a week with Norfika, because yeah, I'm getting a bit busy. But it will keep going. Even when I move to Germany, it will keep going.
Yeah.
Yeah. But I need
I
a
was
lot of people
gonna.
to take the conversations on their platforms as well.
Yeah.
Yeah.
Okay.
That's why we're
Okay. I
here
mean,
with
you
you.
have the yeah. Yeah, I mean, you have the because it does get tiring. As in, it does get tiring having to deal with this like question like those negative comments and all that. Even though you delete it, but you've seen it and you know that why do people think that way? It just drains your energy sometimes. But you know that you're fighting for a good cause and you believe in it so much, you just go forth,
Yeah,
right?
this is just something I can do. Like it's just one way to help.
Mm.
It's a way that I'm most comfortable with because I do have some social anxiety. So I have trouble like going out sometimes, like to do outreach. So the
Okay.
least I could do is try online activism because it could reach more people. Yeah.
Okay.
So I mean, in whatever way you can help, it counts. If you want to donate, if you want to volunteer physically, if you want to do online stuff, advocacy, it helps.
Yeah.
And just be prepared to make mistakes, and it's okay. Learn from them and keep going.
Yeah.
Yeah.
Wise words. Wise words. Okay.
Awesome. Great. So I guess you mentioned that you will still keep going even if you were to move to Germany and
Yeah.
things. I guess what's the next thing, for you equals you in the near future, I guess.
Near future. Well, I was thinking of working with like other student groups or like NGOs and like to further the U equals U message. Like doing an online advocacy campaign, having partners to do it with.
Mm.
But right now my headspace is not there
Yeah.
because yeah, I am quite sad from long distance, and also I have an honors thesis to write, and that's gonna take out a lot of my time. So maybe at the end of the year I'll pick it back up again and think of what else I can do. But right now, U equals U, we've done a lot of talking about U equals U itself, the concept, the science of it. I want to work with Narifika and move it to advocacy. So actually, like starting the tough conversations, such as um, the laws that discriminate, the attitudes that discriminate.
Mm.
I want to move more into that. But it will take some time. There's a transition period,
Yeah.
but it's on the way.
Okay.
Awesome.
Yeah, because I think those two are quite the laws is one thing, right? And then the attitudes towards it. I think those are first two stepping stones to kind of like send out into the world. I feel.
Yeah, yeah.
Yeah.
It's a long road. Nothing will change overnight or something.
Sure. For sure.
And the laws, they will take a while, to be fair, to change.
Yeah.
But in the meantime, then let's try to reduce HIV stigma.
Mm.
As allies,
Yeah.
that's the least we can do lah.
Okay. Okay, Akila.
Awesome. Great.
Okay.
That's awesome, Caitlin. Okay, cool. There are some local feed questions that we want to ask you.
Okay.
I guess we just want to know a little bit more about you on a personal level. Okay,
Okay.
so one of the thing is I want to know, or we want to know really, what is your why and your drive to get up in the morning?
I have to do my thesis.
I was gonna say that.
Yeah, this is really the immediate drive, like to get out of bed. I have deadlines to meet, and I just have to get out of bed. Even though I love sleeping in.
Yeah.
Yeah,
When is it due?
it's actually only due in the 31st of October, but time flies.
Yeah, yeah.
October.
And
Okay
it's a 12,000 word piece,
Oh,
Wow.
so
wow. Okay.
I need to get out and do it. So that's why I get up in the morning. How
Awesome.
is setting multiple alarms that irritate me till I finally get up.
I don't know whether we asked earlier. What are you studying currently?
Oh, okay. We didn't cover that. I'm studying global studies in NUS.
Okay.
I specialize in population and migration issues. Like the syllabus has changed a bit, but when I enrolled,
Mm-hmm.
I studied population migration issues, and I specialize in the South Asian region.
Okay.
Okay.
Oh, and I
Interesting.
took Hindi as a like third language because we have
Hindi.
to, yeah,
Because you what?
we have to take a language. It's compulsory for us to learn a language for the
Oh,
course.
wow.
Yeah, they don't do it now. It's highly encouraged now, but during my time, we had to do it.
Mm. Why Hindi though?
Well, actually, I had a partner who was from India, so
Okay.
it's not a healthy relationship. So he did pressure me to do a lot of things to
Okay.
fit in or like learn a similar language. Hindi is not even his language, but he knows Hindi.
Okay.
Yeah.
All right. Cool. Okay, next one. What's something most people don't know about you that you're really proud of?
Don't know about me. Like, who are the people? Like,
I
just
guess I say friends, right, Zura? Not
Yeah.
like
Anyone, or maybe your family, your friends. Yeah. In general, I guess.
I'm a sex toy connoisseur. Is it?
Really?
Yeah. I actually Marcel started me on this. Um, because we have long distance, and during
yeah.
that time I was recovering from like sexual abuse. So one of the ways to reclaim power is to focus on my self pleasure
Okay.
and what I want. So sex toys are a great way to do that. No
Okay.
pressure from a partner, it's just literally for you. So I bought a couple, but like sometimes I don't buy anything, I just look at it, and like you go to like feminist stores, they actually like give you like descriptions of what it is, where it comes from. So it's like it's quite interesting to me.
Okay.
Yeah.
Yeah, that's interesting.
Yeah, so I
That's
guess my
awesome.
family doesn't know that I'm sex positive. Yeah, and
Cool.
yeah, sex positive doesn't mean promiscuous to whoever is listening.
Yeah, for sure, for sure.
Yeah,
Yeah.
yeah, and that's a good point. That's a good point. Yeah,
Mm.
because people
Like,
always think that. Yeah.
yeah. So like focusing on self pleasure I think is really important. Especially if you're female, you have to like unlearn a lot of things about what sex is. It's not just for your partner, but it's also for you.
Yeah.
I think most people don't know that about me. I think it probably shocks both of you.
No, I mean,
Not really.
because I
I've
Wow.
met
the
I've
thing
met
is
a
because
few
I don't
people.
know you. Yeah, so I
Okay,
think,
okay. Cool.
and
Yeah.
we're both pretty open people. We
Yeah.
accept
Awesome.
whatever they
Okay.
are. Yeah, but that is okay. That is another topic, another for another day, another conversation. The
Sure, I
one
mean
that
we can always like take this
mentioned.
offline.
Okay,
Yeah.
okay. Next question.
Awesome. Caitlin, what is your most humbling experience?
Humbling. Related to HIV advocacy or just in
In
general?
general.
In general.
I guess like recently I'm working with someone and they gave me like very direct feedback. And for me personally, whenever it's humbling because I learn, but also I go into a period of negativity about myself,
Okay.
Okay.
like criticizing myself. But I mean, the I can't disclose too much about what it was, but
Okay.
it was humbling because like usually I try not to make mistakes, but inevitably I do lah. So
Okay, that's nice.
so like it was humbling to learn from it, like truly listen to the other person and learn from it,
Mm.
and not be defensive.
Mm,
That's a humbling experience.
okay. I think indeed it is because for you to, yeah, to learn from that, and I think people tend to kind of like think that it's all negative, but it's actually a learning process for you as
Yeah,
an
yeah.
individual, as a person.
I
Yeah.
guess I also have to learn to not beat myself up as
Mm.
well.
Mm,
Because in the past I will always beat myself up if I make a mistake
okay.
Yeah.
or if someone says something negative.
Mm,
So yeah, just generally when someone corrects me, it's always a humbling experience
okay.
for me to learn from. Yeah.
Okay.
Awesome. Okay. If this is your last day on earth, and you have to leave your wisdom behind, what would be the 3 truths or lessons that you will leave behind?
3 truths. Wow, these are hard questions. It's philosophical. My global studies mind cannot take. 3 things. Spend as much time as with loved ones, not just family, but also your chosen family, like your friends. Whatever you can. Career is important, but not the most important. That's the second one. Third one. If you're not allergic, get a cat.
Oh, love cats.
We all have pets.
Yeah, we do.
I mean, cats are very therapeutic. Even though some of them are not that loving, it's okay.
Yeah, no, they can just sit there, but it's quite therapeutic.
Like just to pet them, just
Yeah.
relax. That's what I do whenever I'm stressed.
Okay.
Yeah.
Okay.
Awesome. Okay, one last one. I hope this is not too difficult. Before we go into 5 seconds of fun, what is your definition of legacy?
Legacy. Well, I always thought that legacy means you've left some indelible impact. And the truth is, everyone can have a legacy. You don't have to be grand or well known to have a legacy.
For sure.
So just like some impact that was uniquely left behind by you. That's what I think a legacy is.
So your legacy will be you equal you? You equals you?
I don't know. But it depends whether my life ends today.
That's true. Very good. You think long
Yeah, no, you're thinking.
further up in the road.
Like me and Muscle could get married, we could have kids. So that, for different people, I leave behind a different legacy.
Yes, that's true.
Oh yeah, that's good.
Correct.
That's a
Like
good point.
if we are not friends anymore, then of course the legacy I leave for you isn't that great, lah.
Yeah.
But for others, maybe for best friends, for partnership, all these things are different legacies.
Awesome. Great. There you go. Okay, we're going to 5 questions, and you have 5 seconds to answer them.
Yikes. Okay.
It's okay. It's not that difficult. Okay. All right. The first one. What's the craziest thing you've ever done? 5 seconds.
God. I don't know. What have I even done? Well, something dangerous I did. Okay, I went to Tibet when I was 15. And when oxygen isn't like so rich when you're at higher altitudes.
Yeah.
I think I still like ran around and stuff. And it's like crazy. It's really stupid.
And then you kind of had mountain sickness, EMS?
No, I didn't, but I did get to the point of passing out almost.
Okay.
Like, really close.
Okay.
To passing out. So,
okay.
Yeah, if you're ever in a higher altitude, please mind your health. But I think that was a bit crazy because it wasn't logical. I knew I shouldn't be doing it, but I couldn't help it because who goes to Tibet?
Yeah, that's true.
Yeah.
Okay. Yep.
Cool. Awesome. All right, 5 seconds. If you could change the world, what would be the top of the list?
To ban homophobia, racism, transphobia.
Awesome.
I would just literally ban it. Like Singapore ban chewing gum, I ban this. Or I would ban sexism as well. Can't mix that up.
Yeah. Okay. Cool. Awesome. Okay. 5 seconds. If you were stuck on an island and there's only one thing you could have with you, what would it be?
Oh, I bring myself.
Oh,
so sweet.
You can scavenge and entertain me.
What's your animal spirit? 5 seconds.
Cat. Easy.
Okay. Yeah. You mentioned it.
Yeah.
Okay. Okay. Last one. 5 seconds. If you had a superpower, what would it be?
Persuasion. Getting people, well, not changing their minds totally, but being very persuasive.
Okay.
Because as Marcel tell you, I like winning arguments. So it really helps if I'm persuasive.
Okay. But anyways, want to kind of ask you, how can we support you? I think you've mentioned it earlier on, different ways that we can support you, but perhaps you can just share it with us again. How can we support you and your Twitter, Facebook, and Instagram, your platforms.
Social media, I guess.
Oh, just it's just Facebook, Instagram. I mean, feel free to follow it and feel free to share any posts that you've done from. And if people ask questions about it, you can redirect them to us. No issues. If you're not sure about something, so no pressure lah. Yeah, I'm always open to receiving questions because questions also help me to learn. So following is important, or at least sharing. We spread the knowledge around. I think just not just me, but also to the cause in general. As I said, you can volunteer for Action for AIDS or gayhealth.SG. You can donate. Yeah, and the money goes to help people living with HIV who are facing struggles in their life. Yeah. And just use your voice. That's, I think, the most I will like. The least I could ask you, just use your voice to speak up. Against stigma, against discrimination, against misconceptions. It's really important. Yeah. I think that's the best way to help what I'm doing and what other people are doing. Because not just me, there are so many other people who are fighting for equality.